So, Excellencies, distinguished guests, ladies and gentlemen, you're very welcome to today's webinar on the Taiwan Model on a resolute path to the SDGs in the COVID-19 pandemic. My name is Patrick Paul Walsh. I'm a professor of international development studies in University College Dublin. So I'm very excited about today's seminar. But first, I'd just like to point out the sponsors. So it's a cooperation between the Taipei Economic and Cultural Office in New York, and it's a cooperation between the Ministry of Health and Welfare in Taiwan. And we also have the Environmental Protection Administration in Taiwan, and also the Geary Institute for Public Policy and University College Dublin. So Geary, if you don't know who he is, his name is Roy Geary, and he was a famous Irish statistician. And actually, he invented the GDP per capita in PPP constant dollars, right? So you all know who Roy Geary is, but you didn't think you knew him. So today, I'm very excited about the two topics because I think there are very strong lessons from Taiwan, in particular from the handling of the COVID-19 pandemic, but also in the handling of the plan towards achieving the SDGs in a pathway towards 2030. I'm just going to make a few brief comments before we move on to an excellent keynote, and we'll have a panel discussion, and we'll also have then a Q&A session with participants. But I just want to make a few short remarks before I hand you over to Ambassador Lee, who will actually give us a welcome talk. It is quite remarkable when we go to the Johns Hopkins website. It is quite remarkable that only 7 people have died as of today in Taiwan, right? Ireland has, we don't have 24 million people. We have about 5 million people, and we have had about 1,800 deaths, okay? Just for a comparison, we're an island like you. But I'm very aware of Vice President Jem because I've been watching him on Bloomberg and on CNBC and all these other things, and he's very articulate. And he's actually quite a famous epidemiologist. I actually knew of him before today, so it's exciting. It's really exciting to hear his talk today. But one thing he said when I was listening to some of those interviews, which I think is profound, is that obviously we're going to hear about how the private sector, the government, society, and the use of technology have come together to actually suppress this virus. And in particular, there is a technique, which is obviously the testing, the tracing, and the isolation. But when it comes down to it, I think today Taiwan has probably put people into isolation, about 250,000 people for 2 weeks. That is just 1% of their population. And just think about it. Would 1% of the population in any country in any year be prepared to maybe go into a nice hotel for 2 weeks and isolate? And it would actually prevent risking having 1 or 2% more of your population dying. I mean, this is really the lesson that we should all be listening very closely today, because those who've decided, like Ireland, to live with COVID, rather than take the Taiwanese model, there are choices, and it really is a choice of agency. Secondly, I was lucky enough to see what's called the SDG, the VNR, the Voluntary National Review that was put together in Taiwan in its making. And of course, I'm from an island. It's not that dissimilar in size to Taiwan when coming from Ireland. And what struck me about their pathway to achieving the SDGs was really their way of using land, because actually to move to renewable energy to move to good public infrastructures, to make the transitions necessary, you really have to allocate your land use in a different way. You've got to think about things in a different way. And I was very surprised at how that was being done alongside technologies and other things. And so there's deep lessons to be learned on pathways to the SDGs, particularly the environmental goals. And that's why we have the Environmental Protection Administration here today. And then finally, we will have a comparator. So we'll be what I call Dr. Ling Wagner from IISD. And of course, there's a nice report in there on the SDG indicators and really trying to see how well Taiwan really have done in a comparative sense on the different goals. And the lesson will be, no matter how good you think you are in any country, I mean, even if you're Sweden, you will not be the best in all these indicators. In fact, you'll be lucky to be in the top 10, but Taiwan does particularly well. But you'll see that every country has a lot of work to do on putting ourselves on a pathway to the SDGs. Finally, my final point of my comment, next Tuesday, you might know this, Audrey Tang, who is your digital minister, comes to every year, but next Tuesday she's coming to our global classroom in our network, and she teaches us about digital governance. And I think, one of the things that will come out today as well is that there's a lot of fear, even in Ireland, when people hear about the role of government and technology and monitoring and isolating. They feel that it puts democracy at risk, it puts human freedoms at risk. But actually, there is a way to use technology. There is a way to do it which is transparent, which actually induces democracy and induces fun and sociality. And that's why, Audrey Tang is such a star around the world, because actually this is a point that, this is transformations in what we call in governance for the SDGs, the digital transformation and governance for the SDGs. Taiwan is really a leader in this, and that it's something that we have to pay close attention to. So with those remarks over, I'm going to hand over to Ambassador Lee. He's a very experienced diplomat, and I think he's going to open up the webinar for us.
Thank you, Dr. Walsh, for your kind introduction. Former Vice President Chen Jianren of the Republic of China, Taiwan, distinguished panelists, ladies and gentlemen, I would first like to extend my warmest welcome to you all for joining today's webinar from across time zones. I would like to thank you, Dr. Walsh, for moderating, and the UCD Geary Institute for Public Policy for co-organizing this webinar. I'm also grateful and honored to have our former Vice President, Dr. Chen, as keynote speaker today, along with two panelists, Dr. Chai from the EPA and Dr. Huang from the Ministry of Health and Welfare. And our special thanks go to Dr. Wagner and the International Institute for Sustainable Development for helping draft a comparative report so that we know where we stand and how to go from there in terms of achieving the UN global goal. This year, the United Nations commemorates its 75th anniversary and calls for a decade of action as the world is braving through an unprecedented pandemic. At a time like this, I'm sure all would agree that the international community needs to make effective, inclusive, and concerted effort to forge a better and more sustainable future. Taiwan is ready to be an active participant and willing to serve as a force for good in the world. Take this pandemic. Taiwan has managed the situation well, with fewer than 500 confirmed cases and a single-digit death toll. There have been no lockdowns, and people can go about their daily life without much disruption. We are also able to provide medical supplies to over 80 countries and share our experience with organizations around the world. In a few minutes, we will find out how this is possible from our former Vice President Chen's speech. Taiwan is committed to implementing the Sustainable Development Goal. In fact, we have been faring on par with many advanced countries. yet we were still being barred from taking part in the UN system. As the world tried to regain its footing while moving forward with achieving the SDGs, the Taiwan model would be immensely useful in this endeavor. But first of all, the UN need to open its door to Taiwan. Turning back to the task at hand, in the battle against COVID-19, no one is safe unless everyone is safe. I hope today's seminar help offer participants a more comprehensive view of Taiwan's best practice and hopefully contribute to the ongoing effort to fight this pandemic. Thank you again. I wish today's webinar great success. Thank you.
Thank you, Ambassador Lee. That was excellent. And this is absolutely true. None of us are safe. Every one of us are safe. So I would like to just introduce Vice President Jin, who's currently a distinguished professor at the Academy Sida Diome Research Center, and he's a renowned Johns Hopkins trained epidemiologist. So I'm going to hand it over to former Vice President for an excellent talk, and I'm looking forward to this immensely.
Thank you very much, Professor Walsh, and dear colleagues. It is really my pleasure and honor to give a presentation on Taiwan model as successful example of COVID-19 management. May I have the slide, please? Okay. Today, I'm going to talk on Taiwan model as successful example of COVID-19 management. Next, please. As we all know that, okay. Also for September 15, COVID-19 already affected more than 29 million confirmed cases in the world and more than 900,000 deaths in the world. In the United States, there are 6.7 million confirmed cases and around 200,000 deaths. But in Taiwan, there's only around 500 confirmed cases with only 55 locally infected cases and 7 deaths. Next slide, please. This slide shows the COVID-19 instance and mortality rate per 100,000 population in the world, United States, and Taiwan. In the world, the instance rate is 377 and mortality is 12. And in USA, it's 2,037 and mortality rate is 60. And in Taiwan, the instance rate only 2.1, mortality rate is 0.03 per 100,000 population. So USA have an instance rate around 1,000 times of Taiwan and mortality rate of 2,000 times of Taiwan. Next slide, please. Next. As we all know that COVID-19 may affect almost all the SDGs from the no poverty, zero hungers, good health and well-being, all the down to climate action. I think that maybe the life below water and life on land are much less affected. And however, that's almost all SDGs are affected by COVID-19. So this is really a timely webinar for all us to discuss about this post-COVID-19 SDG development. Next slide. And I would like to share with you this the reasons for the global failure in pandemic containment policy. The first one is inadequate contact tracing and tracking resulted in the outbreak and city lockdown in Wuhan last December, and followed by the postponed announcement of the public health emergency of international concern from World Health Organization in January. And there's also a delayed border control in many countries of passengers from endemic area in February. And there's insufficient track and trace system to identify cross contact in almost all countries in the world. And a lot of countries also carry out the city lockdown without the promotion of personal hygiene, social distancing, and avoidance of large-scale gathering. And they also carry out a mass screening, but without the 14-day isolation or home quarantine. And the last point I would like to mention for the global failure in pandemic containment policy is the shortage and panic buying of the PPE, personal protection equipment. Next. And with regard to the Taiwan model, there are four principles included prudent action, rapid response, early deployment, and transparency, based on our experience in the SARS outbreak control in year 2003. And on this January 22nd, our president, Dr. Tsai Ing-wen, called a meeting of our National Security Council, and he determined to have a very big action to do this containment and also for the financial relief as well as economic stimulus. Next. With regard to the rapid response to pandemic, we did not carry out any city lockdown, no mass screening, but we use a lot of smart technology. We have a very prudent surveillance of pandemic status using ICT and AI technology, so we can identify any kind of outbreak in the world. There's also a quick announcement of travel warning using cellular broadcast, and stringent border control using e-quarantine system. And we have in-depth tracing of cross-contact of confirmed cases, use ICT and big data analysis. We also enforced home isolation and quarantine for cross contacts and inbound passengers using digital fencing tracking and line bot system. And we carry out precision, so-called targeted screening of suspect with symptoms and signs. And we also mobilized our healthcare system for isolation treatment. We have mobilized 20,000 isolation room and 14,000 ventilators. And we also enhanced hospital infection control using disinfection and delivery robots. Next slide, please. And this is the email we sent to World Health Organization on December 31st, 2019. On that day, our Taiwan CDC officer learned that there's an atypical pneumonia cases in Wuhan. So we immediately sent a reporting email to WHO and China CDC and try to confirm this kind of information. And we also started our containment effort. So we started our COVID-19 containment as early as on the December 31st, 2019. Next, please. And this is the figures shows our stringent border control, including this travel notice and entry prohibition. On the 21st of January, we announced this level 3 travel warning for Wuhan. And on the February the 6th, our nationals of China temporarily prohibited from entering Taiwan, and foreign legs crews are prohibited from docking in Taiwan. And on the 11th of February, nationals of China, Hong Kong, and Macau are temporarily prohibited. And you can see on the 19th of March, all foreign nationals are prohibited from entry without the special permission. And on the 21st of March, travel notice level 3, that's a warning for all countries. So we have very stringent border control. Next slide, please. And for those who were inbound passengers in Taiwan, they have to be subject to home quarantine and for 14 days at home, and close contact of confirmed cases has to be isolated at home for 14 days. And we use electronic security monitoring system to track the location and health status of people subject to home quarantine and home isolation. Next slide, please. And we use big data and artificial intelligence to help us to do this e-quarantine entry, and also we use this quarantine tracking system to trace all the peoples, and we have a digital fencing tracking system and line ball system to help those who were isolated and quarantined. Next. It is very difficult for those people who were quarantined or isolated to stay at home for 14 days. However, we try our best to help them. We provide care and support services for isolated or quarantined person, including the meal or grocery delivery and garbage collection. If they don't have place to stay, we provide a settlement for them. And if they need, we send someone to have a family visit. If they were sick, and they were sent to the hospital using the designated ambulance or for the medical care arrangement. So we try to use this way to let these people to stay at home for 14 days. Next. And in total, we have isolated or quarantined around 300,000 people by September 14. And as you can see on these slides, there's among these 300,000 people, and you can see for those who got a penalty, it's quite a small number. That's less than 0.3%. So in totally speaking, 99.7% of the quarantine or isolated people, they are following the government guideline are quite good, and they comply to our restriction very good. And although we sacrifice the 300,000 people's freedom for 14 days, but in this way, we can assure that 23 million people in Taiwan can live normally, go to school normally, and go to work normally. Next slide, please. For the early deployment for COVID-19 containment, our Central Epidemic Command Center held daily press briefing to announce transparent information, health education, and risk communication, and to resist disinformation attacks. And we also prepare adequate supplies of PPE and other medical materials through mass production and name-based e-rationing. And we also enforced personal hygiene, social distancing, avoidance of large-scale gathering using this online education and self-broadcast. And we also engaged in financial relief and economic stimulus using e-allocation. And research and development of rapid diagnostic, antiviral, and vaccine was also engaged. And we also have an international collaboration on PPE, pharmaceuticals, and technologies. Next. And with regard to this and the early deployment of the face mask, we formed a national mask team, and we have a requisition of 73 factories to expand the 92 production line, and the average production of face masks per day increased from 1.8 million in January up to 21 million per day in May. So we have adequate supply of the face mask in May. And next slide, please. Before we have the adequate face mask, and we carry out so-called name-based distribution system to assure that everyone in Taiwan, no matter they were poor or rich, they all can get this face mask at a very low price in order to assure everyone can put on face mask in their daily activity. Next slide, please. And when we have the adequate production of face mask, we also try our best to donate there's a face mask to Europe, to USA, and to our diplomatic allies, and just as mentioned by Ambassador Lee, and more than 80 countries. And we have donated the face mask to help the health personnel in these countries in need. Next slide, please. And this is the enforcement of self-management of health. And since in Taiwan, there's a multicultural, so we use 7 languages to let everybody know that personal hygiene is very important. They have to wash hands thoroughly with soap or sanitizer, and also wear surgical mask and avoid crowded places, including the hospitals. Next. And social distancing measure was announced on April 1st, and people are encouraged to keep a distance 1 meter away outdoor and 1.5 meters away indoor. And we also encourage people don't go to this place. There's a large gathering of the people there. Next slide, please. Next. And COVID-19 impact industry a lot. And so we are now moving to a so-called new digital world. And COVID-19 accelerates digital transformation. In Taiwan, the online consumption increased to 1.8-fold. And there's a shock industry, including the transportation, tourism, physical entertainment, physical retail, as well as food and beverage. And we also have bonus industries, including the healthcare and epidemic prevention, otaku economy, and also the semiconductor production, as well as electronics and ICT and equipment. Next slide, please. Next. May I have next slide, please? President Tsai Ing-wen convened a high-level National Security Council meeting on March 12 and announced proactive measures to boost Taiwan's economy momentum and vitality. We allocated a 210 billion budget for epidemic control, financial relief, and economic vitality, and shift spending priorities to emergency measures and increase the government investment and procurement, and also help acceleration of private investment. And we also try to maintain foreign exchange market stability and stock market momentum. Next. Next. From the very beginning of the pandemic, Taiwan government has ensured that the public has open access to COVID-19 information. And our CCC has held daily press briefings since January, which generate accurate news across a broad spectrum of media outlets, and CCC quickly established its authority and earned the trust of the public. Public trust has had a stabilizing influence on society, encouraging citizens to follow government guidance and rules and making the public less vulnerable to disinformation. And it resulted in a virtuous cycle. The more the public trust, the more people are willing to cooperate. So transparency and public trust are the natural product of the vibrant democracy in Taiwan. I consider that solidarity basically is the key for the successful containment of COVID-19 in Taiwan. And I would like to share some of the statistics recently. And Bloomberg Economics assess and rank the COVID-19 control of 75 emerging and frontier economies based on confirmed deaths from COVID-19, level of activity, compared with pre-virus normal and the policy space available to counter the damage. And Taiwan was ranked as the #1. Next. And also, there's Newsweek Japan also assessed the response to COVID-19 in 49 countries based on epidemic damage as well as the economic damage. And Taiwan was ranked as #1. Next. And this is the most recent data from Oxford Martin School. They show this percentage decline of GDP in Q2 of 2020. And as you can see on the top of this map, that Taiwan have a recession about around 0.6%, and this is the lowest in the world. In other words, there's an economic decline in Taiwan was the lowest among the 38 countries compared by this on our world in data. Next slide. Next slide shows this the GDP growth as well as this cumulative days. And you can see that in Taiwan, we have the lowest GDP decline and lowest cumulative days. So economic status can be assured, can be maintained if we can contain this COVID-19 very well. In most of the countries, the better the containment of the COVID-19, the better the economic stability. Next slide, please. Next. Next. Okay. However, in near future, there's still a lot of challenges of COVID-19. I myself consider that first wave of COVID-19 pandemic still persists globally, and many countries have low infection rate and low herd immunity. And global economic recession is very serious. So we have to try our best to have a border reopening. However, border reopening may increase the number of imported cases and the risk of local outbreak may occur. And in the coming future, especially in the winter time, the seasonal influenza in coming winter may increase the difficulty in differential diagnosis and clinical management of COVID-19. Next slide, please. Next. Next. Okay, so we definitely need international collaboration. We all know that virus respect no border, and any pandemic or emerging infectious diseases is detrimental to global health, economic development, social stability, national security, and regional peace. Of course, almost all the SDGs were affected by emerging infectious disease pandemic. So no country can fight the pandemic alone, and help each other is the key for the success of pandemic containment. Next. And this is a beautiful message from our Holy Father, Pope Francis. I just want to show you the first section. It said that rivers do not drink their own water, trees do not eat their own fruit, the sun does not shine on itself, and flowers do not spread their fragrance for themselves. Living for others is a rule of nature. We are all born to help each other, no matter how difficult it is. Life is good when you are happy, but much better when others are happy because of you. So we have to help each other. Next slide, please. Next. Okay, I think that every cloud have a silver lining. And although COVID-19 affected the SDG in the world seriously, but I consider that if we can help each other and to reach a global solidarity, then we can minimize the impact of COVID-19 to the global health as well as the global economies. So I would like to conclude with saying that Taiwan can help, and Taiwan is helping. Taiwan is willing to collaborate with all nations in the world, try to contain this COVID-19 and stimulate the economic growth in the world. With that, I would like to thank you very much for your attention.
Thank you, Vice President Yang. So that was a very comprehensive overview. And what surprised me was the detail in the economic package, because this is exactly what people were told to do, to take the 210 billion to invest in your health system, to support your financial markets, and to actually develop, to use what's called a Keynesian demand pull counter-cyclical strategy to get you out of threat of a recession. So it was a very comprehensive presentation. So we will be taking questions later, but I think we'll move on to 3 presentations now, which are a bit shorter. Our first is going to come from Dr. Su Eng, who's the medical officer of the Taiwan Center for Disease Control from the Ministry of Health and Welfare. So we will continue on this theme of combating climate COVID-19 while assuring individual health and well-being is essential. So I'll hand it over to Dr. Song Hen.
Hi. Can I have the slides, please? So good morning and good evening for people here. So Dr. Chen had already touched on some of the public health actions, but I think here I would go into a little bit in depth of some of the actions that we have done. So COVID-19 began as a rumor that was passed around the internet. So this was first picked up by the Taiwan Centers for Disease Control because we have long established a comprehensive surveillance system. Currently, COVID-19 surveillance in Taiwan has 2 parts. So it's international and domestic. For international disease surveillance, because COVID-19 now occurs mostly outside of Taiwan, event-based system to collect essential information for COVID-19 and epidemics in countries around the world. More importantly, we perform our own rapid risk assessments based on the intelligence collected and decide on how to respond to outbreaks in those countries, specifically travel restrictions and border control measures. Domestically, we adapted our already established surveillance system for COVID-19 surveillance, which included case-based surveillance for testing and reporting of suspected cases, laboratory surveillance that was expanded to include testing for SARS-CoV-2 in respiratory disease surveillance, and continued our syndromic surveillance to monitor the trend of respiratory disease occurrences. Next. From this graph, we can see that we detected the outbreak in Wuhan on December 31st, 2019, and started onboard inspection for flights from Wuhan. Then on January 16th, we listed COVID-19 as a notifiable disease, enabling case-based reporting and activated our Central Epidemic Command Center, or CECC, a few days later. On the 23rd, we implemented home quarantine for travelers from Hubei after Wuhan was locked down. Because the outbreak was only in Wuhan at the time, we restricted travel to Taiwan for Wuhan citizens. And as the outbreak spread, travel restrictions was extended to people from Guangdong and then to Zhejiang, then all of China, Hong Kong, and Macau, and then the Republic of Korea, Italy, Iran, and eventually to include all countries by March 21st. The light purple in the graph shows the number of tests conducted through case-based reporting. These increased as the outbreak spread around the world and citizens returned to Taiwan, then decreased when the border was shut. The light aqua that you see in the graph shows the number of extended tests, which included testing of contacts and enhanced surveillance in our communities. These increased as our testing capacity increased through April. Changes in our border control strategy and testing strategy were all based on extensive international and domestic surveillance. Next. Case investigation and contact tracing is another important arm of our COVID-19 response. Can I have the next slide, please? Once a suspected case was reported, the case's specimen will be collected and tested with results reported within 24 hours. If the test result is positive for SARS-CoV-2, a confirmed case is found and public health authorities will launch epidemiological investigations immediately. The public health worker will investigate the confirmed case's activities during the 14 days prior to symptom onset to when the case was isolated, finding all the close contacts. For infection source finding, we would ask contact if they were symptomatic. If they were asymptomatic, so no symptoms, then they are given health education with follow-up calls to ensure that they have stayed healthy. If a contact develops symptoms or they were symptomatic, the person is a possible source of infection. The contact would then be referred to a hospital for isolation and testing. For people who had contact with the confirmed case during the 2 days before the onset of symptoms of the confirmed case, until just prior to the confirmed case's isolation, these contacts need to undergo 14 days of quarantine. During quarantine, if they become symptomatic or were at high risk of infection, these people would be referred to a hospital for isolation and testing. If people under quarantine remain asymptomatic during the 14 days, quarantine will be lifted, followed by 7 days of self-monitoring. Next, please. We have learned over the years the importance of adhering to risk communication principles. We strive to be timely when providing information, transparent with the information which we provide, and as much as we can, we proactively provide information that's needed. Risk communication is also multifaceted through live streamed press conferences, giving charts, tables, and posters on the Taiwan CDC website. We push information through social media such as Facebook, Twitter, and Instagram, and we use chatbots on messaging apps. In the beginning of our COVID-19 response, when cases were few or came in clusters, press conferences were conducted whenever new cases were confirmed. These resulted in chaotic scheduling for both CECC, the reporters, and the public. As cases increased, we settled on a set time for daily briefing. Then as cases dwindled, the frequency of press conference decreased accordingly. So you can see the picture here. It's the press conference that was conducted by the Deputy Director General of Taiwan CDC, announcing the first case of confirmed COVID-19. So notice the backdrop is that of Taiwan CDC and not very neatly hung. Next, please. So over time, we learned that people representing different aspects of the outbreak response needed to be present at the press conference. The backdrop here, you can see that changed to the CECC, and it's very neatly placed in the back. We also added sign language interpretation for our live stream press conferences. Next, please. Through timely and transparent risk communication, we were able to gain the confidence of the public, who in turn responded by complying with our control measures. One of the most difficult control measures to adhere to is the 14-day quarantine. So we give special attention to care for persons under quarantine. For people under quarantine or need to undergo quarantine, designated taxis are provided for a fee to take people from the airport to their place of quarantine if they had just arrived from abroad, or to the hospital if they had developed symptoms during quarantine and need to go to the hospital for testing. There are also designated hotels for people who do not have places to quarantine, and funds were given to local governments so that they can provide care packages, meal deliveries, and even garbage collection for people under quarantine. So here you can see a sample care package for people under quarantine. In this sample, there are masks, dry foods, and food supplements for the body, Buddhist scriptures for possible spiritual needs, and magazine for entertainment. We have also seen some care packages that included fresh vegetable, 14-day movie streaming pass, and even kits for people to grow small plants. These care packages were designed to provide care for the whole person. For people who need medical attention, home visits and telemedicine appointments were arranged. We also set up a hotline staffed with counselors to provide support for people's mental health needs. Next. The general public had also been compliant with community disease control measures, including social distancing, which discouraged large gatherings, physical distancing of 1 meter outdoors or 1.5 meter indoors when out with others, and mask wearing, especially in crowded places. And once again, because of the confidence the public has in CECC recommendations, people are generally very compliant with their disease control measures. And there are also voluntary measures that have been taken by institutions, offices, or even large and small shops. They may provide alcohol-based hand sanitizer at entrances, set up fever screening, or require shoppers to wear masks when entering to the shops, or use partition on tables at restaurants or other places for eating. So here you can see our volunteers in our mental health hotline gather for a meeting, each wearing masks. Next, please. So through the response of COVID-19, we have learned that taking care of individual health doesn't necessarily mean that we are ignoring the general public. Next, please. In fact, it is because we are taking care of individual health that we could achieve population health or public health. Thank you.
Thank you very much, Ms. Pence. Again, an excellent presentation and giving us even more detail on exactly how the testing and contact and tracing and quarantine works, and then most importantly, how you actually care for the individual when they're in quarantine. I think it's a very valuable lesson. We're moving on to the next presentation. Presentation 2 is from Mr. Hong Tae, who's the Deputy Minister of the Environmental Protection Administration. And now we're going to move more towards the Sustainable Development Goals, because we know the rhetoric is to build back more resilient, more inclusive, and build back into environmental sustainability, because we all realize that caring for people and caring for the planet, it's all about solidarity. And a lot of the issues that we're dealing with COVID-19 are exactly the same issues to deal with climate change and to deal with biodiversity and so on and so forth. So I'm very much looking forward to this presentation.
Okay, thank you, Professor Walsh. Slide, please. Okay, since the publication of Taiwan's first VNR, that the voluntary national review in 2017, and in 2018 and 2019, government officials and citizen representatives worked together to formulate Taiwan's 133 targets and 336 corresponding indicators, and through national level oversight, ensure that all government agencies incorporate sustainable development into the future policies. This year, Taiwan has completed its first supervision and evaluation to track accomplishment of goals, and a relevant report has been published on the website. In the following, I would like to share with you some example of Taiwan's implementation of Goal 5 and 11. Next, please. Okay, next. First of all, let's look at the issue of the gender equality. In early society, since agriculture was dominant, patriarchal value was universal. The newest survey by the Health Promotion Administration found that the sex ratio at birth in 2019 was 1.069, which is reaching international average. This means that the public's belief has been gradually changing. As you know, next please. We have our president, Dr. Tsai Ing-wen, is a female, and also we have a minister, female minister for the Ministry of Economic Affairs. Next. There are 21 female leaders around the world, and during the COVID-19 pandemic outbreak, we also see that the female-led countries such as Iceland, New Zealand, Norway, Denmark, and Germany tend to perform better than others. Next please. As in the women in parliament, that in our country we call the legislative yuan, the percentage of the female lawmakers was increased 33% in 2012, 1% in 2020. We can see that the power and influence gap between men and women in national affairs has gradually narrowed. And compared with the world average, world average is 24%, and compared with the 2007, that means almost a 20% increase for our women women in the parliament. Next, please. Next, I would like to talk about the resource recycling and more pollution sources related to sustainable cities. Next, please. This is a report of the Wall Street Journal in 2016. The article says that Taiwan, the world's genius of the garbage disposal. And you cannot imagine that that in 30 years ago, the garbage disposal treatment. And this article says that the Taiwan's recycling rate is 55%, and for surpasses the US is 35%. So we can see that from the national, international media and related report, Taiwan's effort in resource recovery have been recognized. Next, please. Just behind Germany, and why Taiwan can have such a so many achievements in this area. Next, please. Because we have the achievement is attributed to the in 4-in-1 recycling program in Taiwan. The 4 refers to the public community cleaning team, recycling enterprises, and recycling fund. Together, they form a sustainable recycling mechanism. Next, please. Through campaign and education in communities and schools, everyone is taught to develop the habit of sorting their waste and recycling. Children learn how to deal with the garbage starting from kindergarten. Next, please. When dumping garbage, people cooperate with the cleaning team by placing recyclable and resources on the resource recovery trust, so that the garbage is effectively classified and properly disposed of. Now, I would like to talk about the next topic, more pollution sources. Next, please. As you know, that we have a lot of the motorcycle, almost 14 million in Taiwan. That compared with we have 59%, 59.3 per 100 population. So, with the annual sales of around 9,000 motorcycles, Taiwan has the world's highest motorcycle density. This is because most of the population live on the western plains of Taiwan. Since it does not snow in winter, motorcycles are used for transportation all the year round. Therefore, if we can solve the pollution problem of the motorcycle, the effect will be remarkable. That's the reason why Taiwan has been promoting electric scooters in recent years. Next, please. Government incentives and subsidies have been promoted continuously since 2015. The sales of e-scooters have doubled every year. In 2019, the number of the e-scooters sold in Taiwan reached almost 168,000, accounting for the 18% of the overall motorcycle market. From the beginning to the present, it can be said that there are very good results. Next, please. The new generation of the electric e-scooters are not only aesthetically pleasing, but can also be linked to the smart home. smartphones, making it very convenient, customizable exterior, and its environmental image also attract a lot of younger consumers. Next please. Compared to the conventional vehicles, the biggest challenge for the e-scooters is charging. Currently, there are more than 2,000 electric scooters charging stations throughout Taiwan. In an urban environment with a large number of the batteries, the present stations can be set up. E-scooters will become very useful for short commutes. Next, please. Due to the impact of COVID-19, this year, many people have switched from taking public transportation to riding motorcycle. Take, for example, the 10,000 e-scooters have sold in March this year. We see an increase of 42% compared with February. In view of the success of the Taiwan's bike sales system, we call it U-bike. In the future, Taiwan will also promote shared e-scooters, reduce the number of the unused motorcycles in the city. There will be further cutting down for the air pollution. Next, please. For many years now, Taiwan has been actively promoting environmental protection. We hope that the entire citizens can pursue sustainable development in healthy environment. Taiwan is willing to abide by regulations set by the SDGs and share our experience with others so as to achieve the SDGs with the world. Thank you very much.
Thank you very much for an excellent presentation. And it was great to see SDG 5 and SDG 11 brought together because all the goals are interrelated. And Ireland has not had we've had a president of Ireland, Mary Robinson, who you're all aware of, but we have not had a prime minister of Ireland. So it's great to see that those countries are actually performing the best on COVID-19 and most likely on the SDGs as well. So we come to our final presentation, and we're going to look at, do a bit of comparative work. So Dr. Lynn Wagner is the Senior Director of the Tracking Progress Program in the International Institute for Sustainable Development. And they have a IISD of a very nice report, which actually compares Taiwan's performance on various indicators to countries around the world. So I'll hand it over to her for the final presentation of the panel, and then we'll open it up for questions.
Thank you very much, and thank you for inviting me to participate in this really interesting webinar. As the previous speakers have indicated, there are a lot of ways in which Taiwan is excelling and can really help the world see, have some examples of what best practices are. And examinations of the SDG indicators are meant to do that in many ways. We can look at the indicators, compare countries, see where countries are really excelling and achieving the SDG goals, and then look and see how they've done it and provide examples for others. I think the pandemic examples that were discussed today are case in point of how case studies could help other countries, other nations think about how to really excel, to copy best practices. So on the screen, you see a URL for a platform that we have created using available data from the UN Statistics Division and the Environmental Protection Administration in Taiwan. Using that data, we examined 58 indicators across advanced economies to see how these advanced economies were doing. I'd encourage you to visit this online portal to examine the data yourself, but please wait until the webinar is complete to leave and to go off and do that. But so today I'm going to look at how SDG indicators could be examined in a number of ways. I'll focus in particular on two ways. One is looking at the distance to the 2030 goal from where the indicator is right now, and then also the comparison of advanced economies of countries with their peers. And so in this case, looking at 19 advanced economies and seeing where Taiwan falls vis-a-vis its peers. So the next slide. So when we look at the 58 indicators for Taiwan, we find that on 13 of the indicators, Taiwan has already achieved the 2030 objective. These include maternal mortality ratio and under 5 mortality rate. Taiwan has already achieved 100% access to electricity. Unemployment is low. So these are some of the examples that Taiwan might be able to share with others of how it's already achieved these objectives. In some cases, the indicator asks whether or not a policy has been created. And so in many of the cases, Taiwan already has that legislation or that policy in place. And I think as the discussion today shows, Taiwan isn't just putting those policies on the shelf, it's really using them to drive its actions and examining how they can be adjusted and made, purpose-built for this particular challenges that they're facing. One example of a legislation that's supposed to be in place or a strategy is the National Disaster Risk Reduction Strategies in line with the Sunday Framework for Disaster Risk Reduction. So Taiwan already has that in place, but presumably is keeping it active and alive for the next 10 years, thinking about how to really use it to drive implementation of the other issues. So then some of the other indicators for which Taiwan isn't quite over the line, it's very close. A number of those are going to be issues that require implementing the SDGs as a package. So some of the final line, the final mile to achieve some of the food security issues, some of the mental health issues, that's going to require a package of health SDGs with food security SDGs, with education SDGs. And so that's really the crux of the challenge of the SDG framework and the 2030 agenda. So that's really where you dig in. And so Taiwan can look at how well it's combined some of its activities to achieve multiple objectives at once, and share those examples, because that's really where I think the world needs those examples. A few of the indicators that Taiwan hasn't yet achieved haven't been achieved anywhere because these are brand new issues for the international community. They include reducing material consumption per capita, and material consumption per GDP. These are things that have been worked on. They're things that we knew about before the SDGs were created, but really digging into that and achieving what the indicator and what the targets talk about, those are some of the real challenges for the next decade. And then a few of the indicators require identification of what the challenge is in the specific national context. An example of an indicator for which there's no innate best number would be the number of commercial bank branches per 100,000 adults, or the number of automated teller machines per 100,000 adults. That indicator, that target, doesn't have an innate best number. So Taiwan and every other country would be looking to see what is best in the context of achieving all of our other goals. Where do we want to be with that? So that's just some of the work that every nation is digging into right now to think about how to fit those targets and help them drive the other achievement on the other targets. Next slide. So I think what is really one of the interesting things to do with this data is to look at how countries are doing vis-a-vis their peers, because that also helps you see where you have the best practices that you could share, where you might want to look to see what some of the other peers are doing. And so that's what's shown on this table. So the blue lines are where Taiwan fits in a comparison with 19 advanced economies. As you see, for some of the indicators, we don't have data for all 19 advanced economies, but it's pretty close. And we only had enough data to do this comparison across 19 indicators. As we go on the next 10 years, we'll be able to increase both numbers to do these kind of comparisons. And again, this is using the UN Statistics Division data and the information from Taiwan EPA. So we find that Taiwan's in the top quarter for 8 indicators and the second quarter for 3 indicators of these 19. So well over half of these indicators, Taiwan's in that top half. And then when you look at those indicators that put Taiwan in the top quarter, includes some of the indicators for which Taiwan has already achieved the 2030 objective, such as the unemployment level, forest area as a proportion of total land area, and unsentenced detainees as a proportion of overall prison population. Taiwan's also in the top quarter for several SDG 3, the health indicators, proportion of births attended by skilled health professionals, personnel, and adolescent birth rate. While the proportion of seats held by women in national parliaments, as we saw, 41%, that is huge compared to any other country around the world. It's still not, 50%, where if you look at, the full representation of men versus women, but Taiwan is doing amazing compared to its peers on that one. And so, what are different factors that are leading that? That is certainly a lesson that that the peers, countries around the world could hear, especially in light of the evidence that countries that have female-led leaders are doing so much better in responding to the pandemic. So I guess just in conclusion, we have the indicators can really show where Taiwan has strengths to build on and share lessons for its SDG implementation efforts. It points to areas where further attention is required, either just because it's new issues, it's issues that Taiwan needs to figure out what's best for the national context and how the different pieces will help drive change. In all countries are having to gather more data. So as we get more data, we'll be able to have even more robust views of where the lessons are and how we're doing as we get closer to 2030. And then there, a key thing is to look at where the indicators haven't yet achieved the 2030 goal. And if those are issues that are really going to require a concentrated effort, bringing together multiple SDG targets to concentrate attention to those particularly, really sticky challenges. But so thank you very much for letting me share this, and look forward to seeing what Taiwan's examples are in the coming 10 years.
Okay, thank you very much, Dr. Wanger. That was an excellent presentation as well. So we've had 3 related but different presentations. And so I guess I've had down here that we're going to have a panel discussion. Now I have questions that are coming in. So I think what I'll do is I'll start with Ms. Song En, if that's okay. We'll start off with the pandemic questions. So there's a question here from 2 youths or young people. One is Najat, who's the Director of Advocacy in the World Youth Alliance. And then I have another one from Ireland, actually, Ned or Edward Lyons, who's doing a Master's in Sustainable Development. And both asked kind of a similar question, so I'm going to put them together. So the first question is, it's just looking at, well, how could countries learn from Taiwan's experience? And I guess, so for countries that might have different cultures, or they're more spread out, they're not islands, like for example, like big countries like the United States have a huge continuous space. Countries that respond differently to privacy and sort of liberty issues, around being told to actually isolate. And then what Edward Lyons brings out is this idea: how do you keep the spirit and the solidarity? Because it kind of happened in Ireland after the first wave, when you actually see no deaths, like Ireland had no deaths for a long time, and yet we still have all this activity around testing and tracing and isolating. Like, how do you keep the solidarity going in people? Because they could easily turn around and say, Taiwan doesn't have a problem. We don't need to be putting all these sort of resources into identifying and tracing this disease and quarantining people. So they're similar sort of concepts. How can we take the Taiwan model and how can we apply it to other countries, whether small countries like Ireland or a big country like the United States? How can we do this?
Right. So I think that's a really interesting things that have been pointed out, that, Taiwan we're very unique, that we're an island and we're small and we're very densely populated. So, in many ways that, people may think that we're very, very different, but in many respects, I think, a lot of things that we're doing has already been done in many other countries. I mean, the surveillance is being done in every country, but I think we're all doing surveillance, but we have to trust in our own surveillance system, and we have to constantly review our own surveillance and use our surveillance information for our own use. So I think each country we have the systems, and we just need to make sure that we are actually using that information that has been gathered and really trust in the scientists. I think a lot of times that we feel like politics gets in the way when we're responding to a pandemic or any sort of outbreak, but really just trusting the science. And, we need to just gather good information and do good science. And so that we can have our scientists provide good and sound information. Things in Ireland, as you pointed out, that people are getting tired of adhering to all the control measures, and we see the same thing happen here. But I think that because we've been at it for how many months now, and we're not seeing that many cases, and we're definitely not seeing cases in our communities right now. But it's a constant reminder when we're telling people that there are, there's still outbreaks around the world, and we do still get cases that are identified through people who are arriving from abroad. So people are constantly being reminded. So I think, building that trust between the government and the people in general, and constantly reminding people, and and sometimes just changing a little ways how we're communicating, and that all helps in making sure that everybody understand that we're in this together, and that unless everybody is practicing good hygiene, then there's definitely going to be outbreaks going on.
Excellent. So there's a question I'm going to stay with you, Dr. Sung-Ed. There's a question from Christine Chang, and she's an evaluator in New York City Department of Education. And I guess there's concerns about opening up the schools. And she's just wondering, what are the conditions for you, maybe where you'd close down the schools, or what would be your advice to countries who are living with the pandemic and they actually have opened up the school? What sort of maybe techniques or things they could do to actually open up it's safer? Or what's her opinion on the whole opening up of schools and children?
We're probably not the best people to answer that question because we don't have cases in our community. So we actually haven't had any school that has had to be shut down because of COVID-19. But with that said, we do have plans that has already been drafted since February of how we're going to shut down schools. And, so there are plans in place that, as soon as we're not seeing cases in the schools, that we feel like it's pretty safe to keep our schools open. But, all the schools have actually asked the students and the teachers, when they're in very close, enclosed spaces, and they're, when they cannot practice good physical distancing, then they need to be wearing a mask. And even that, so what we have seen is that, we are requiring children, as young as they're in preschool and kindergarten to wear a mask. And it's very, very difficult to do. But, as long as we can get most people or most children to wear masks correctly, and they start very young, learning how to use the mask, then I think, our society as a whole and the schools can stay fairly safe. So I already mentioned that we don't have COVID-19 in our communities, and we certainly haven't seen that in our schools. But with all the mask wearing, what we have seen is that we usually have a enterovirus outbreak, starting in April, and then, it peaks around June when school is at the end of the school year. We haven't seen that this year. So what that shows us is that wearing masks is working, and that children could comply with mask wearing. But, that's the situation here where the children do model their actions after adults who are wearing masks. So I think, those are some of the things that we can try in other countries where, we have adults providing good models for children, and children getting used to using the mask and practice good physical distancing, social distancing.
Excellent. Thank you. So I think I'll move to Dr. Wagner, if that's okay, because I have a few questions here. Abraham Joseph, he's Vice President, co-founder of Development Goals Watch, and he's particularly interested in this indicator approach, and whether, when you're looking at SDG 3, the health indicators, just like in some ways, I think we got from the keynote that suppressing COVID-19 has actually allowed, for society and for the economy more to not contract as much as you see in other countries. But in a similar way, is there anything that you see in SDG 3 that would suggest that if you're better at the health of people, you're better at the health of the planet and health of the economy? Can you see those linkages across the indicators, or do you even try to ascertain that? And in particularly from a Taiwan perspective?
Thank you. No, and I think that is a really good question, and that really reflects the understanding of how the SDGs are so interconnected. Our study didn't look at those interlinkages and calculate all the contingencies and the relationships, but I can tell you that Taiwan is well on its way, if not already at the 2030 objective for a lot of the SDG 3 indicators, and also the SDG 8 indicators for economic growth. So I'm not going to come up with conclusions that I haven't done the full calculations on, but we do see that.
Yeah, and a question from Ireland as well about from Fiachra Kyo, Monaghan Education and Training Board. But his question is about, I guess it's the whole idea of a global agenda for local action. And in a sense, there is this idea of the duty bearer, even though it's partnerships, is more at, say, national level, right? And well, so what sort of mechanisms are there really in the UN to incentivize or to try and facilitate or help or anything to a country to actually implement the SDGs? And really, is there an absence of a push for multilateralism on this? Because at the end of the day, I think our keynote alluded to, we can't really control this pandemic into the long run, or we can't really do anything about climate change or any of these things if there is no multilateralism, if there is no cooperation across nations. So in a sense, when we're looking at indicators at national level, you know, how do they help us get this agenda done? Or do you have comments on that? It's a tough question, I know, but you know the UN well, so I'm sure you're able to answer.
Right. No, and I think that's the inherent question with having cooperation in a system of sovereign states. So every country has sovereignty, has a decision over what it's going to do. They enter into some treaties that may or may not have sanctions, or they enter into agreements for kind of frameworks for how they're going to collaborate. And so the SDGs are a framework for collaboration. There's no sanction for not cooperating. But I think that the SDGs really speak to what it is that countries, that communities, that businesses, that multiple actors, sectors are trying to achieve. And they've provided a language for those sectors to talk together. And so a growing number of local communities are seeing how this can be adapted and used in the local context. And then they're having the opportunity to speak, you know, with mayors in small cities and large cities, speaking across the world with their counterparts. And they have this shared language to speak with. And I think it's just that, you know, it means so much for so many groups, and that is what is really driving the SDGs. It's not that it's a top-down requirement.
Yeah, thank you very much. And that leads us nicely into last but not least, Mr. Hung Tae. So you don't really have to answer this question because I think it's just an obvious answer. But there was just commentary on you showed obviously that countries that have women leaders are doing better on the pandemic and on the SDGs and all around. And why do you think that's the case? I think it would be a very short answer.
Yeah, because we have female leaders, so I think it's a comparative to the other leaders. It's just a kind of comparison between the leaders of the women and leaders in such as the United States. It's a little different. So I think it could be just like Taiwan as a very special case, and also the other leaders in of the female also they are very good example, especially for such as Norway and other countries. They are still very good, and also the New Zealand, right?
Yeah, I think the short answer is we all know women are better, and that's there's nothing to discuss. So then a tougher question in a way, though. So it's very interesting to look at city level, but in any part of COVID economic package, you know, the 200 and I think it was 10 billion. That was spent on a reaction to COVID. The Environmental Protection Administration, did you get a chance to have a look at the investments and look at the sectors that were, let's call it, bailed in or bailed out, or even the way the health sector is built? Did you get a chance to actually lace, if you like, or determine that those investments were socially inclusive and environmentally friendly? Because this is a lot of money being spent on investing for the economy and for health. But there was an opportunity to make this environmentally friendly. So do you think you got an opportunity to actually build back what we call more inclusive and build back more sustainable, but that with that 210 billion that you were able to dictate the orientation of that towards the SDGs?
Yes, that we call the different phase. The first phase is to bail out because they really need that kind of money, and the other phase we are going to try to figure out a program that we call the Green Recovery Program. That's already reviewed by our executive yuan, and it will be final about this month or next month. But I think this will be a guideline for every agency to do this kind of thing, and they will think about more green policies, such as the green economy or green financing. That's all included in this kind of program.
The final question was focused on cities. Do you think sectorial or city approaches, and particularly if you twinned with cities across the world, do you think this is a better approach to implement the SDGs, or what do you think of that way? Because I think that was alluded to by Dr. Bangler.
Yeah, I think it's a very good example for us to look at this kind of SDGs, and it's very helpful because using this kind of SDG, we can look at or review other agency policy, because every indicators or every policy, they will be connected into this kind of SDGs. So it's all connected in this kind of 336 indicators. So I think it's really important for us to look at other agencies to do something about this kind of, especially for their policy concerned with this kind of the SDGs.
Okay, so that was really excellent. So it's my job now just to put some final remarks, just closing remarks, and to thank everyone. So I thought this was a fascinating webinar. I guess when I'm looking at Taiwan, and the one thing it's all very fine to say to use this AI and these technologies to invest these funds, but you can't underestimate how coordinated technology, the private sector, community, and government have to be here, right? Because when you see similar things, like say in Ireland or other countries, we're trying similar things, but we're just that little bit loose on what companies are doing, just a little bit loose on community. The politics is a little loose. We're not adapting the technologies or investing 100%. So this just gives the virus a chance to move. And the thing about this virus is it does move. Like once you loosen any of those cogs, it loosens, right? It really flies, right? And you go into your second waves, etc. So I think what is amazing about this experience is the coordination that's there and the solidarity that's there, but it is really a whole of society approach. I mean, absolutely led by government and led by science and using technology, but it's very much a whole of society approach. Now, as pointed out though by Vice President Zheng, is that unfortunately, to deal with a pandemic, to deal with the global economy, to deal with climate change and other zoonotic and other biodiversity issues, having a whole of society approach within Taiwan is not enough, right? You have to have it at a global level, right? And the problem with this model, is it sustainable when your neighbors, and I mean the rest of the world, are going to go into, say, a global financial crash or a global economic crisis, or at the end of the day, you have to open up your ports to someone, people have to come in, and then again, the disease comes back in, right? And this points, of course, to this sort of whole of society approach for the SDGs has to happen at a global scale. This has to be, multilateralism has to come back into favor. We cannot go down the road of nationalism, nationalism over vaccines, nationalism over anything. We really have to become global citizens. And I was delighted with Vice President Zheng's ending from Pope Francis. So he's quoting there from, Laudato Si, which is all about getting people to realize what we say is that the cry of the poor and the cry of the earth actually their origin is from the same thing. So the reason why we have social inequalities, the reason why we're harming nature so much, it all comes back to the same way we do our governance and the same way that we run our economies. And it's good if some countries with female leaders take the lead, but it's not going to be enough because we need this kind of global approach. We need this global multilateralism to come back. And of course, this is something that everyone is hoping and pushing for. And there are certainly great lessons from Taiwan, but none of this can happen. And even from Taiwan into the future, we do need the global solidarity. We need this whole of society informed by science, led by governments, to actually click in, and the sooner that can happen, the better. It's hard, but this is the challenge for humanity. And I would say that I don't know where this virus came from, but think of a virus that comes into the healthiest of the population, the ones who are supposed to look after children, look after old people, and somehow they are okay, right? But and it's not clear yet because we know there's long-term effects from the virus, even in young people or in middle-aged people. But the reality is that the virus asks us to actually to have solidarity because we don't want it to harm other people. We don't want it to flood our hospitals. We don't want it to end up displacing people who need care for other diseases. So it's actually asking us to care for others and not just to think of ourselves. Okay, which is an unusual thing to happen in a virus, right? Because my memory of the pandemic, the Spanish flu, was actually that in the second wave, it actually went to the young people and away from the vulnerable people, right? But this disease is really challenging us to care for others. And in the same way, when we look at the floods and the fires and the other things that are happening globally, we are now we're asked to care for nature and for other species to actually protect our extended families and our future of humanity, etc. Right? So there's something in that sort of call from Pope Francis, as it was, or from your Vice President, to say, look, this is not rocket science. We need to learn how to care for others and care for nature, and that's how humanity itself will move forward and have this prosperous and inclusive and sustainable future. So I'd like to thank, obviously, the sponsors, and hopefully everyone enjoyed the webinar. And if you have any other questions, I'm sure you can email them in and people will contact you. So it's afternoon here in Ireland, and I know it's morning in New York, and it's quite late in Taipei. So I wish everyone stay safe and stay well, and hopefully we learn to work together for suppressing this pandemic, but towards a better future and achieving the SDGs as soon as we can. All right, thank you very much, and thank you, everyone.